So I'm going to talk about something that happened in my family that has had some serious and very useful consequences in Trinidad. Trinidad is a developed country, which is sort of at the upper level of the developing countries. It has a reasonably good healthcare system. The people are very well educated. It's under the British system. And a few years ago, about 10 or 11 years ago, my sister was diagnosed with cancer. They thought it was breast cancer, but it turned out to be lung cancer. And as a result of that, she died a few months later. But during the time that she was, as she called it, living with cancer, she and my mom had lots of conversations about, when I am better, we're going to do something. We have to do something for people who are suffering with cancer. And because of Mom and Dad's position in society, they were able to help Trinidad access very good health care. Unfortunately, shortly after she died, those people, the two doctors who had looked after her, one left for Germany and one left for the US. And they were specialists in what was called palliative care. Now, palliative care is a unique discipline which is quite multidisciplinary. The interesting thing about it is it treats not only the patient once they have been diagnosed and going forward, but they also treat the family. And that is one of the essentials about it, which is not often understood. It is multidisciplinary, and it may have healthcare people like pharmacists, doctors, nurses, social workers, people who are religious, religious ministers or whatever. And it is a very broad discipline. What happened in Trinidad, unfortunately, is that people get into the healthcare system there, and they go through it. They're treated, but often they die. Sometimes in great pain, because there was no one left who could treat them. So Mum and Dad talked about things, and as my cousin said, a very determined woman said, Trudian wanted something done, and we're gonna do something about drugs. Well, when they went to talk about the drugs, they said, sorry, we've got the drugs, the government can give this, but that palliative care piece, those people are gone. There's nothing, there isn't enough of it. So the result was that Mum went online, and she found up here a doctor called Dr. Larry Liebrecht at Mount Sinai in the Tamiletna Palliative Care. It's a clinic. So we went to visit him, and what was remarkable was we knew as we walked in, and Larry said, in his Hawaiian shirt, said to us, do you mind if I have lunch while we chat? Because I've been busy all day. And we talked with him, and we knew that something worthwhile would come of it. And the Palliative Care Society of Trinidad and Tobago is part of that. So in 2011, 2 years after Trinidad died, the society was founded as a not-for-profit. It's now received its charitable status. In 2014, they set up a ward in one of the government hospitals as the first non-government organization government partnership in the country. So the objectives and goals of the society were to improve the provision of palliative care in Trinidad and Tobago, and to transform the care of these people who have these diseases. Now, most people think of palliative care in conjunction with what's called hospice care. Thank you. Hospice care is the actual treatment of somebody as they are dying, to make sure they're comfortable, that they can actually have a good quality of life as they go up. And one of the things about palliative care is, from time of diagnosis until whenever they pass, they really do need care. And so the Palliative Care Society set out to do that. But remember I said the two main people who were doing this had left the country. So what they realized was there was that need for training. And that was one of the first things the society set out to do. And yes, please. And Larry actually came down to Trinidad and helped train. Now this club also, when we spoke about this, said, we want to help. and they actually gave us $2,500 towards helping get things set up. When we went to see Larry and he agreed to do this, we said, well, we've actually got some money that my Rotary Club has given us, so we can pay for you to travel to Trinidad. And he smiled and he said, well, if this was the US, that's different, but this is Canada. We have a budget for that. And every year since, someone from Tamiletna has come down to train at the conferences. So who's involved? Doctors and healthcare professionals, as we talked about. The families, because families are very important in supporting people as they go through this process. And friends and volunteers. And you'll see a little bit more about that as we go along. They've done a number of things since. Every year they raise money with the Poor Man's Dinner. Trinidad has this tradition of putting these things on. People who are poor usually go to soup kitchens, so they have these dinners where people pay large amounts of money to go have soup and bread. And some of what's been nice is that the Palliative Care Society has had some people who come along and said, well, you know what, you need fruit and you need desserts and all that, so they've chipped that in as well. Every year they have a palliative care conference where they bring in experts from around the world. We've had people from England, Canada, India, and the other islands of the Caribbean come down to present on various things. One of the big achievements was that they actually had masters in palliative care that was instituted. Now I talked about this non-government thing to set up a palliative care ward in Trinidad and Tobago. And what has happened as a consequence is that over 4,000 people and their families have had help. And this club should be very proud of what they've done, because we actually, as a club, we actually helped this get going. And it's changed the lives of so many people. And it's accelerating. As you can see, up to 2017, almost 2,000 people went through the ward. They've had over 500 people since. They've had end-of-life care in the clinics, symptom control, and psychosocial, I hope I spelled that right, care. And that's very important because it is about looking after the families as well. I was shocked, for instance, to give you an example. I had a client who was dying from cancer in Canada, and she had at-home care. When they decided this was going to be done, boxes of stuff arrived, and her brother was looking after her. And her nurse came in, looked at him and said, you look really stressed. Tomorrow, I'm going to arrange for someone to come and look after you. And the next day, a massage therapist arrived with a portable table and gave him a massage because he was so stressed. So that's the kind of other care that is really important. This, in 2014, as I said, the palliative care unit at Cora Hospital was set up. Now, Cora Hospital is situated on a mountain, and it was originally for TB. It was a TB sanitarium. These were the first graduates from the master's program that I talked about. And they've gone on. In there are nurses. There's a doctor she's actually one of the doctors who works at the unit now. And the one in the middle is the one who actually led the course. And he's got US certification in palliative care. This is the patient, one of the patient bays. The ward has 12 patient bays, which are set up in open wards of 2 or 4 beds. The great thing about this is that the Palliative Care Society, through its fundraising, raised everything except the walls in this place. Right? They provided the beds, the blankets, pillows, everything that's in there, as well as various other things within the facility. So the public-private partners, they provide all of this stuff, and the government provides staffing. So it's worked quite well. And the big problem, of course, is that the government loves the idea, and they want the society to do one of these in each. There are about 5 or 6 health regions in Trinidad, and they want them to move there. As I said, the setting is very beautiful. This here is what's called a saman tree. It's hard to tell the scale of this thing, but it is over 200 feet across, across the whatever that's called. Right? Yeah. And the tree is several hundred years old. This here is out under the tree. In the back here, there's a gazebo. When we went there, or when Dad and Mom first went there, this place was a big, empty, abandoned ward, and a beautiful garden, and that was it. And Dad said, well, you know, the place you've shown us isn't really what we need. We'd like somewhere to get people out. And the fellow said, don't worry about that. And 2 days later, he punched a hole in the wall. They built a path out. Behind them, there's a pool which has koi in it, and I'll show you a better photo of that later. And they built a gazebo.
So palliative care and my family, how it has affected me. Before my mom was diagnosed with cancer, I knew nothing about palliative care. Because of a good friend, I was referred to the palliative care unit, and it truly changed the perspective that I had from visiting the Cora Hospital as a treatment unit. Palliative care has given us such a new perspective of how you can treat with someone during that end of life care that is necessary. In terms of my family, it has done so much for me, where we were able to interact with professionals who could have guided us as to what this terminal illness is going to cause. And it gave us a sense of comfort of what was required of us as a family. It helped us especially to deal with the situation in terms of us dealing with ourselves as caregivers. It helped us to really understand what is required for the patient and what is best for the patient. So in all, it has really opened our mind to how to treat with someone through palliative care, and it has had a significant impact in how my family see what palliative care is, and we as a family can now promote palliative care to our friends, family, and the larger community.
The society provides ongoing training, and this is a masterclass in palliative care, where they had experts come in and actually sit with people who work in the field and help them with training. And as you can see here, this involves having chats, because one of the big things in palliative care is sometimes getting people out of themselves. They're in such pain or they're in such despair that they don't know how to express it. And this is a way of facilitating that. One of the programs they started there was painting. So there are two things here you can see. This person is actually in a bed. Because of the redesign that took place, they can actually be taken out on their beds. And this is painting therapy. And so they can sit in the gazebo in this lovely environment and find some peace in doing something that's creative. This is the view out of the unit. And these gardens, all the shrubs and all these sorts of things were donated. The interesting thing was the head gardener here had a rose garden at home. So all the roses that you see, he made cuttings and brought them. Friends of the family, like our neighbors down the hill, Dad was saying to him, well, you know, we wanted some help, and what do you need? And the next thing he gives us these huge potted plants to bring up to this place to help it up. And it's remarkable how people have been. This is looking at the unit. So this whole wing here on the lower floor is where we're talking about. And this is the koi pond. Interestingly, when the guys who were building this, they asked, what's this for? And they were saying, well, you know, we thought we'd have a pool and maybe get some fish. The workers went out and bought koi and stocked this. The latest initiative of the is to a daycare. And a company in Trinidad had people who were connected with the company who went through the unit and had care there. And every year they donate $250,000 Trinidad dollars, about 50,000 of those, to anything that the workers in the place that work there decided, much like what your people do with you. And these people decided they wanted to give it to the Palliative Care Society. And they specified that they'd like a daycare center so that people can drop in their activities, there's care. And one of the big things with palliative care is people often don't get a chance to, if you need to go to the bank, but you're the only caregiver, you can't. So here they can arrange for someone to be looked after for the day. Our club has agreed to help, in conjunction with our sister club in Trinidad, the Rotary Club of Port of Spain West to buy what are called oxygen concentrators. Now, some of us have seen these in use before. The idea behind this is that it actually removes or concentrates the oxygen in the air so that people who are ill can get a chance to breathe a little bit better. When they heard about what the work we've been doing, I've been supporting it. And last year we decided to help purchase of one of these oxygen concentrators. So on their behalf, I'm happy to present this here and thank you for the work you do. This is my sister, who was this thing was started in Montreal, she would have been 59 this year, but I think she'd be very happy to know that she has helped change the world a bit. And as of you, thank you very much for the support you've given.